United Nations is forecasting that India's economy will grow by 7.5% this calendar year and rebound later to 10.5% next year, with the caveat of high fragility. And that's in our faces. We can see that because of the brutal COVID-19 wave. But what do these numbers really mean? What is the human scale to it? Chief of the UN Development Research Branch, Dr. Hamid Rashid, is with us to talk through some of those numbers. Over to you, sir.
Thank you. I think it's a very good question. There's no straight answer, unfortunately, because we are in the middle of a pandemic, and the situation in India is worrisome for everyone, not just for Indians living in India, but also for the rest of the world. And as you can see, that forecast numbers can vary significantly from month to month. And IMF, when it published its World Economic Outlook just a month ago, they were far more optimistic about India's recovery. But this was before the second wave that hit India earlier, late April and then early May, and it is not subsiding as yet. So, but we're still, and when we finalized our forecast numbers for 2021, we were just seeing the tip of the second wave. And of course, even if I had to revise the numbers right now, I would probably be a little bit even less optimistic than 7.5%, because there are significant downside risks. But having said that, we still believe there's huge room for a recovery in India, because we are starting from a very low base. Last year, there's a significant contraction of the economy. So this is basically recovering the lost ground. So there will be quite a bit of lost ground recovered, and that would give the growth, assuming that pandemic comes under control within a month or so. If it continues for several months or a full quarter, then this would be a very difficult target, or difficult would probably see a significant downgrade when we update our number for the end of the year. But so far, we remain optimistic that a 7.5% growth rate is still possible for India. And just to have one caveat there, IMF numbers are on a fiscal year basis, and our numbers are on a calendar year basis. So when IMF projected the number for 2021 fiscal year, that was from July of 2021 to June of 2022. So that means down the road, of course, there's a lot of room for growth, but we are looking strictly to the calendar year, and that's where we are. Our difference is quite significant. Yeah.
Arun?
Yeah, I was wondering, what do you think should be India's focus right now in terms of coming out of the economic doldrums due to the COVID-19 pandemic?
Yes, I think it's vaccination. And I think restoring confidence, consumer confidence, business confidence will be very, very critical, because when you see news reports every day and it shatters confidence, businesses would not be willing to invest if they don't see any light at the end of the tunnel. Consumers would not be spending if they feel that there are bad days ahead. So this is about managing expectation. And right now, the best way to manage expectation of the future of the economy is to make sure everyone gets vaccinated as quickly as possible. And there is serious inequity in vaccination right now, as we have highlighted in our report, that many of the countries, they are not even at a 10% level, and other countries are at 60, 70% or 70 doses per 100 people in their country. So there is this inequity is a challenge, not for a particular country, but for the global recovery as well. So would expect that Indian vaccination campaign would pick up, and that is an absolute imperative.
But the vaccination issue is going to be more difficult because the availability factor, and having to vaccinate 1.4 billion people. So in the interim, is there anything else that India can do, or to manage the situation in terms of the economic recovery?
I think the Indian experience with the first wave was quite positive and quite successful. I think it's a combination of vaccination and social distancing and other measures would work, would not do the magic, but would still be able to contain the spread further. We are seeing some numbers are coming down significantly in Delhi and Mumbai and other major cities. But then if it spreads to the rural areas, then there's a huge concern as well. So we have to make sure that we are able to contain the spread of the virus, and things don't get any worse than it already is. So our best hope is that this is probably the worst is behind us in terms of the spread of the pandemic in India, and there are some containment measures that are effective. And I think vaccination drive would pick up as if the global supply improves. Global solidarity is very important. Number of countries are coming forward to help India. It's a global cause. A pandemic is not a national crisis. It's a global crisis. So I think a global cooperation would be very important. I think if vaccination, the raw materials, and India is the largest producer of vaccines. So once the materials are available, I think the production would pick up very quickly, and we would be optimistic that this in a month or two there'll be turnaround, a significant turnaround, and that would again put the economy back on the trajectory of growth.
Dr. Rashid, I'd like to pick up on several ifs in your answers.
Yeah.
And we understand that the strength of modeling is in the assumptions, right? We understand that, and this year has taught us that more than ever at any other time. But what would be the baseline conditions, absolute baseline conditions that you would require, or the modelers would require, for any of those numbers, or that range of numbers, say between the high 6 to the mid 7s, to happen?
The main, if you know macroeconomics, the main actor in an economy are the households. Households account for 70 or 80% of the spending in an economy. If household spending shrinks, if they're not able to spend for various reasons, one is that because of the restrictions or because of their expectation about the future. If they all feel that that we are entering a doomsday scenario and the economy would not recover, they would start saving more. They would not spend. And that would become a self-fulfilling prophecy. If you don't spend, you slow down the economy. And then you say, see, I didn't spend. See, the economy is doing so bad, but we don't take personal responsibility that, oh, we didn't spend because the economy slowed down. We said, okay, we were correct in our assumption that the future of the economy is very bleak, but we also, all of us partly contribute to the future of the economy. So the baseline, I think, is a very good question that you asked, is that absolute baseline is that to restore household confidence. And that would be critical, and that actually can come back very quickly. If you see the US case, right now household spending has exceeded the pre-pandemic level. And initially, the middle of last year, we had a very doomsday scenario for the US, but it changed very quickly as soon as the household spending picked up. And there, of course, US stimulus measures played a very important role. For developing countries, stimulus spending, adding like giving more fiscal financial buffer to the households, and so that they can spend and they can create more demand, would be very critical. So in case of India, it's no exception. The baseline would be that to bring back the household spending, and household spending is also related to business investment as well, because if your businesses are investing, they're keeping the jobs intact. If they are expanding, then households would have more income. So it's all related in macroeconomics. All the actors are interdependent, households and businesses and government. So government must play a catalytic role right now in terms of restoring confidence in both in households and also among the businesses.
You see the situation in South Asia overall, in terms of recovery from the pandemic?
Yeah, I think out of South Asia, India is the largest economy, and other economies in the region are very interlinked with India. Nepal, Bangladesh, Sri Lanka, and all this, Bhutan. So the way we see it, this is also an opportunity for governments and for the public sector to increase investment in health infrastructure, increase investment in digital infrastructure, and that will create jobs, and that will create demand for more goods and services, and that will restart the economic engine. So this is not a lost cause. A crisis often presents an opportunity, and it is no different for South Asia, given that there's so much unmet investment demand. Digital divide is very, very big in South Asia. So governments should prioritize digital investments right now. Investments in healthcare system, because right now you see the oxygen shortages is a huge constraint for in India in terms of saving lives. So this is an opportunity for creating the right environment so the businesses can invest more in building health capacities, health response capacities. So, and all these investments would have multiplier effects in terms of steering recovery, a quick recovery. So as we may feel a little despondent right now in terms of what is happening in India, but there's a silver lining in our view as well. We don't want to be overly optimistic. In my press interview yesterday, we said we're cautiously optimistic about the global recovery. There are a lot of downside risks. But in case of South Asia, I think there's a particular opportunity to increase investment rates. And this is investments, increasing investment would require borrowing from future. And invest correctly, and it will pay off. So would strongly expect that an investment would pick up, especially public investment in healthcare, infrastructure, digital technologies. All of them would create lots of jobs and lots of demand, and economic recovery would follow.
Dr. Rashid, you were talking about how the US has managed it after a precipitous, situation last year. We saw that last fall. But here we have a surface area of 342 million. In India, you have a surface area of 1.4 billion. So, we have to have adjacency when we compare, right? How do you really think we can make those comparisons? Because we are talking about two very different, population bases here.
No, you're absolutely right. But also you have your neighbor on the north. China has managed very well in terms of containing the virus very early on, and also again investment. And they made investments, unlike the Western model of fighting the crisis. You can have a demand side support, like giving money to the households, or you can create more jobs through investment. And China chose the path of increasing investment during the pandemic. And so it created lots of jobs. And now the demand is picking up, and China's recovery is on the way. China actually would have 8.2% growth rate this year. And China's population base is even larger than India's, and they managed it well. So the question right now is the question of how quickly you can expect investment to pick up. And this is where public investment would play a very important role in key sectors of the economy I already mentioned. And these are where India has huge opportunity for investment, because it is untapped sectors, like in the health sector. Improvement can create many jobs in India and create huge demand. And these are not long-term issues I'm talking about. Even in the short term, they can create a lot of jobs and a lot of give a lot of boost to the to economic growth.
Do you see a risk from deficit financing, when you call for public investments in this current situation?
It depends whether you're asking a Keynesian or a monetarist economist. I tend to be a Keynesian, and I believe deficit financing in a situation like this is not only necessary, it's a must. You have to take the risk, and when businesses can't take risk, when the private sector or households can't take risk, only entity that can take risk is the government. So public sector spending is we have seen crisis after crisis. Public investment is what brings countries out of crisis. So yes, deficit spending, but this is where one has to be very careful about targeting the right sector, targeting the right investment. Otherwise, it can create a huge debt burden going forward. Public debt would balloon, because deficit financing is basically borrowing from future. Or you have to increase taxes, which are very difficult in countries like in South Asia. You can't get much tax elasticity from economic growth. So it has to be basically a huge debt burden. So I am strongly in favor of deficit financing in times of crisis to stimulate the economy. And India has room for that. And India should move forward and basically invest in the right sectors to stimulate economic recovery.
Thank you very much, Dr. Rashid, for taking the time to speak to us. Thank you very much.
Thank you. Yes, my pleasure. Thank you so much.
Thank you.